All right, so this is a very interesting talk today, something I feel like really I had to give because it gives you perspective. So I went to medical school from 1979 to 1983, and I was obviously, I mean, I just have to say, I was a gullible 22-year-old. And I entered medical school to learn from the experts how to heal my fellow man. And I trusted that the research had been done and the truth was being told. And while I was in medical school, I just stuck to absolutely everything that they said. Some things were so far out, I was just like, you know what? I live my life not paying any attention to that. I'm not going to start now. For example, I always heavily salted my food. I just love salty food. And for them to tell me in medical school that salt is deadly, I'm like, you know, maybe it's deadly for other people, and that's good to know. But for me, it's really working out very well. So there were a lot of kind of snags like that. And every time where I was taught something in medical school, and I personally had a real world life experience with it, it turned out that what they were saying was absolutely false. Now, to kind of plan for this but maintain credibility, of course, we were told that half of everything we're taught in medical school was false. They just didn't know what half, so they taught us all of it. So today, what I'm going to go over with you is 6 things I was taught in medical school to never, ever allow my patients to do because it would kill them. Yet, these 6 things, each of them, turned out to be the doors to absolutely miraculous healing. So I'm going to share these things with you one by one. And I'm going to tell you what evidence there was that these things are deadly, harmful, or dangerous. And I'm going to show you my experience and what I've concluded. So the first thing we'll start with is enemas. So we were taught in medical school to never, ever, ever write a prescription for an enema. The enemas were deadly and dangerous and to never, ever be used. Don't use them because they kill people and people die of toxic megacolon. If you look up toxic megacolon on Dr. Google in 2021, you will find absolutely no reference whatever to enemas. Clostridium difficile perhaps, but no reference whatever to enemas. So all of a sudden in 2021, enemas, toxic megacolon, no. But if you look up on the other hand, you know, try to stick to the subject, look up poisonous or deaths from enema. If you look up deaths from enema, what you will find is it says deadly enemas. And I Googled deadly enemas. And all the deadly enemas are enemas prescribed by doctors using pharmaceutical agents. So here we are. Deadly electrolyte abnormalities following an enema. And this is the deadly electrolyte abnormality following an enema administration. And it was a sodium phosphate enema and used to relieve constipation. And this may cause older people to suffer kidney failure or even die. And this is 2012, which is pretty recent. So these are sodium phosphate enemas that are sold, that are pharmaceutical products from drug companies. Alcohol enemas are extremely dangerous, and children apparently are doing these, and death, we don't know, but extremely dangerous. Coffee enemas, for that they say there's no medical scientific evidence to support any positive claim for this practice, and medical authorities advise the procedure may be dangerous. So a coffee enema, after all this research that they've looked into, may be dangerous, and the phosphate enemas, which are on the market, which are sold for medical use by drug companies, are definitely deadly and have killed people. Now, what is this? And I personally have been doing coffee enemas for 30 years myself on my body, and you can see the results. I'm here, I'm alive, I'm talking to you. So what's going on with this whole enema thing? So as far as deadly enemas in terms of medical school, because I was there, so I can say this, doctors used to prescribe 3H enemas, high enemas. That means the tube is inserted very high in the colon, hot enemas, boiling water was used, and hell of a lot. That means large volume, like in excess of 2 quarts. And what this did was it literally cooked the person's intestines and killed them. And so obviously 3H enemas were a bad idea. Now coffee enemas, if you do a coffee enema using a quarter cup of coffee grounds, 1 quart of water, simmer for 30 minutes, strain, restore the volume to 1 quart, and use that as an enema, let's say once a day or twice a day, it's absolutely harmless. And what I found with working with people naturally is that using enemas, a lot of times it's incredibly helpful in getting people results with their healing that were otherwise not possible. So are enemas deadly? My conclusion, if you use a volume of 1 quart, a temperature of 104 degrees or less, and twice a day or less as coffee or water, distilled water, then no, enemas are absolutely not deadly. They're totally safe and extremely beneficial for healing. And so here we have the first lie told in medical school. Now, I just want to say we need some kind of benchmark as to what is safe. And I think we can all agree that Tylenol is considered to be safe. So that we'll use that as our standard. And so I asked Dr. Google how many deaths there were from Tylenol in the year 2018. And the number, unequivocally straightforward, 458 deaths. Now, just for your information, in the year 1992, they admitted to 2,000 deaths from Tylenol ingestion. But we'll take the 458 number, and we're going to say anything that kills fewer than 458 Americans a year is safe. That's what it is, safe. If it kills fewer than 458 deaths a year, we can't find more than 458 deaths in a year, we're going to call it safe. And what if we find 0 deaths? Well, if we find 0 deaths, then we're going to say that the suggestion it's a hazard is absolutely a lie. How about that? So in the case of enemas, deaths in 2018 from enemas, coffee enemas, 0. Okay, so that's the enema story. Next, and this one's a very, very sad story. This is the fava bean story. So many of you who are listening to me are from the United States. So you might not know about fava beans. The fava beans is known as a broad bean. It's a big, huge bean, huge bean. And we're told in medical school that we should never eat fava beans. We should never allow any of our patients to eat fava beans. And if we find anyone's eating fava beans, we should tell them to stop because fava beans are deadly. And if someone has what's called a G6PD deficiency, it's an enzyme, then they could die from eating fava beans. So no one should ever eat fava beans. And so having discovered the healing effects of enemas, I said, wait a minute, could fava beans possibly have a healing effect? Answer is yes. It turns out that if a woman eats fava beans during her pregnancy, especially the first trimester or before the first trimester, it prevents birth defects. Can you imagine? No need to screen for Down syndrome anymore. No need to do chorionic villus sampling, very expensive prenatal test. Or amniocentesis, just have the lady eat some fava beans at a whopping cost of maybe $10 if she overpays for it in the first trimester. How shocking is that? That here we have fava beans, the cure for congenital birth defects. And doctors are instructed to never, ever allow their patients to eat these. So the next question is, well, if fava beans cause a death in G6PD, let's see what happened. I like to use 2018 because it's the most recent year for which statistics are available. Yes, it is shocking that we have a society where so many things are monitored, and yet there's such a big delay in the availability of information. So here we have the fava bean story. So the fava bean story is from 2013. It says urine is dark, that would be a dark brown or black, full of hemoglobin, level of bilirubin in the serum is high, Parents, if asked, almost always report that their son has dark urine and has eaten fava beans. A well-described case history brings the topic alive as the authors describe a typical scenario of a boy. Remember, it's a typical scenario. They can't point to any one. This is just typical, but we don't have any one example. Age 2 to 10 years with acute tiredness, pallor, abdominal pain, and is peeing at night, peeing blood at night. And he's jaundiced and his spleen is enlarged. So once the diagnosis has been made, management is usually not difficult. The treatment is straightforward. Mild cases need only hydration, it means drink some water. And symptomatic treatment means maybe some pain pills. But for others, blood transfusion is required and is rapidly effective. Done. Not a deadly condition. At worst, it can require water and a transfusion. Any deaths? No, none recorded. And I even went back, I could not find just any death at all at record. I could find an occasional hospitalization. Again, it was always a child, it was always male, and home in good health. So are fava beans deadly? The answer is no. Now, what else did I find out? Well, I found out the G6PD is an enzyme made in the liver and contained in pork liver and beef liver. So you can simply eat your fava beans with some pork or beef liver, and bam, you're not going to get this situation. Now, the fact that the kid is getting this around 10 years of age, he's in a family that eats fava beans clearly regularly, suggests that he simply has this enzyme deficiency. And again, it's easily remedied just by eating liver along with it. Now, the other thing I looked at is, okay, so we have this thing called G6PD deficiency. Do people who have this genetic problem have a shorter lifespan? So is this particular enzyme deficiency a cause of early or premature death? The answer was absolutely not. In fact, people with this genetic deficiency, lack of enzyme, actually live longer. So we have a G6PD situation, which is classified as a deficiency or disease, when actually people who have it live longer. And we have a bean, favism, classified as deadly, not having killed anyone in recent medical history, but the cure for birth defects. Now, the other thing about fava beans is they are also the cure for Parkinson's disease. So a person can literally eat fava beans in place of their Parkinson's medication, and they will get as good a result as with the Parkinson's medication without any of the side effects. How cool is that? So, medical school, truth meter, 0 for 2. So, enemas, deadly, never do it. Not deadly, false. Fava beans, deadly, don't ever eat them. Not true, false. What else did they tell me in medical school? The next thing, of course, vegetarian diet. So we're told in medical school, vegetarian diet? No, never, ever, ever. If anyone goes on a vegetarian diet, it's terrible. They will die. Do not allow your patients to follow a vegetarian diet. So it turns out a vegetarian diet is the cure for heart disease. So if a person has heart disease, coronary artery disease, chest pain, going on a vegetarian diet with lots of fluids and frequent bowel movements, like 3 a day, bam, chest pain gone, no more heart disease. And Dean Ornish, famous doctor, did quite a bit of research in this area. Oh, good. Did quite a bit of research in this area and found that a vegetarian diet absolutely eradicates coronary artery disease. You don't need coronary artery bypass surgery. Coronary artery bypass surgery is absolutely, totally, completely, 100% unnecessary. Bypass surgery or even stents. The diet gives symptomatic relief at least as quickly, which is amazing. So vegetarian diet, wrong. Now, what do we do know about vegetarian diet is a vegetarian diet is a long-term health strategy where you're vegetarian permanently, forever, and always is not healthy, but you can say that about really any diet. So the vegetarian diet, deadly? Answer, no. Another falsehood. But I would say for anyone on a vegetarian diet or keto diet, whatever, at whatever point the diet is no longer beneficial to you, then it's time to switch to another diet. So vegetarian diet, 0, meaning false. Vegetarian diet is not deadly. The next thing we're taught in medical school, now remember, this is not a trivial matter. You know, here was medical school, tuition at that time was only $10,000 a year, but hey, 10,000, 10,000. Year of my life's a year of my life. So it's 4 years from $40,000 spent learning stuff that was actually devastating for patients. So these are the cures that are not only being withheld, but being maligned and discredited in medical school by your doctor. Not only is your doctor refusing to look at these, but many natural healing programs, schools, and bodies of knowledge have totally eradicated this stuff. So that's the vegetarian diet. We're now 0 for 3. Next, famous, right? Turpentine. Yay! So in turpentine, in medical school, we were taught again and again that it's very important not to have any turpentine in the house. Children were dying of turpentine, and we had to do this for the children. Get turpentine out of the house and make sure it was never ingested. So I looked up turpentine deaths. Again, 2018, because that's the most recent year for which statistics are available. Now remember, we had 428 deaths from Tylenol in this particular year. So let's take a look at turpentine. So a lethal danger in the home. Now lethal, let me tell you, means deadly, okay? This doesn't mean dangerous, it means deadly. Lethal danger in the home, turpentine poisoning. So it's a 9-year-old boy, and every single test, every single report has been a 9-year-old boy. The one who died, by the way, of turpentine ingestion, 30 cc's, was a 9-year-old boy. And that was in the year 1930 something. But I don't know what it is with these 9-year-old boys. But here we have a 9-year-old boy, and supposedly this happened in 2015. Ahmet Güzel wrote this. So we have to question, what country did this come from? It says toxicology, human experimental toxicology, and we don't have any information what country this came from. But let's just say it came from the United States, okay? So this is the most recent. This is poisoning. 9-year-old boy. The patient was admitted to our clinic with suspected intoxication after accidentally drinking from a glass that held a turpentine oil preparation used by his father for hair care. So what do we have here? Was this pure turpentine oil? No, it was not. It was a preparation, unknown other ingredients. The patient, 9-year-old boy, displayed no significant signs and symptoms other than slow heart rate and low blood pressure. Laboratory investigation reveals no abnormalities. Hospitalized for close monitoring and observation. In other words, they just looked at him. During a 2.5-day observation period, his blood pressure was corrected with water and dopamine. It's a heart drug. And he was sent home alive. He did just fine. So this is not a lethal danger because nobody died, right? So we can't even find as many deaths from turpentine as there were from Tylenol. Tylenol's 458 deaths a year, and that, believe me, is a low count. And so with turpentine, we have a hospitalization, one hospitalization 6 years ago. So that means there was no hospitalization in 2020, 2019, 2018, 2017, or 2016. This is one hospitalization in 2015. Excuse me, this is Turkey. This is in the country of Turkey. So we have nothing in the United States. Even though I Googled the United States, this Turkey thing came up. But this is how safe turpentine is, and this is how rare any problems of it are. So what have I found with turpentine? Oh, major miracle, true blue spectacle. It's a miracle come true. With turpentine, you can heal tumors, arthritis, asthma, diabetes. There's just no limit. And you guys can go to my website, vitalitycapsules.com, free report, Candida Cleaner report, tells you all about it. Again, another lie from medical school. We're now 0 for 4. Next is cholesterol. Don't ever let your patients have a high cholesterol. They'll die of heart disease. Now, for me, this was a little suspect because they kind of told us this on the way out the door. But I knew that cholesterol was the fundamental building block, necessary building block for testosterone, for estrogen, for progesterone, for cortisol, for aldosterone. So all of the adrenal hormones to coordinate the energy systems of the body and the immune system are 100% dependent on cholesterol. And your body only makes 75% of the cholesterol it needs, which means if you follow a diet with 0 cholesterol, cholesterol is only present in animal products. With 0 cholesterol, then you have a cholesterol deficiency. So the body actually has an absolute requirement for dietary cholesterol. And here we're being taught in medical school to not allow our patients to consume cholesterol or have a high cholesterol level. Cholesterol also is essential for the brain. So the brain is mostly cholesterol. And so if you lower the cholesterol or get it out of the diet, the person will literally start devouring their own brain and scavenging parts for cholesterol to maintain the rest of the body. And this causes Alzheimer's disease. Also, low cholesterol causes chronic pain. So it turns out that by getting doctors to prevent people from having high cholesterols, the medical industrial complex created a whole new industry of aches and pains, arthritis, fatigue, and dementia. So here we are, 0 for 5. Next, cow brain. Mad cow disease. I can't tell you how many times in medical school this was emphasized. That if you eat the brain of a cow, you will get mad cow disease, and this prion parasite, never isolated, will literally turn your whole brain to jelly. And this was spread from person to person when women ate the brains of their deceased husbands in a certain culture. Primitive, of course. Now, since then, since 1983, it's been 40 years. Yeah, good 40 years. No organism identified, no person-to-person transmission identified. Strangely enough, this prion cannot be transmitted from any other tissue of the cow except the brain. Not the spinal cord, not the steaks that are right next to the spinal cord, by the way, not the flesh, not even the milk of the cow can transmit this never isolated thing. So by this time I was feeling pretty bold. I said, wait a minute. In medical school, they told me so many things are deadly. Not one thing I was told in medical school is deadly actually turned out to be deadly. Not one. So I said, let me try some cow brain. And I did, and I felt immediately more intelligent and more brilliant. Now, the other thing, which is even more amazing, is I had an immediate improvement in mood. I was upbeat, happy, excited, and energetic. I said, this is amazing. Well, I'm going to keep eating this stuff until something goes wrong. So I've been eating cow brain now for at least a year. I'd say, yeah, a year. And it has been nothing but awesome. I have recommended it for other people, and when they eat cow brain, any and all mental disorders evaporate, whether it's mood swings, whether it's irritability, whether it's depression, whether it's panic, you name it, gone. So another 0 for the medical school. And so here we are. The major things medical school taught me were deadly, harmful, to never, ever allow patients to do, turned out to be the doorways to healing and preventing pretty much all of modern day ailments and allowing people to live a full, life into their old age without being debilitated or crippled.